knock knock. Hi, my name is Morgan. I'm your nursing student today. I have orders from the doctor to give you some IV medications. Can you verify your name and date of birth for me?
Joe Smith, 10/14/1982.
And do you have any allergies?
Sulfa.
Okay. We shouldn't have any problems with the sulfa, but if you do feel anything weird, let us know. I'm gonna wash my hands. I'll put on gloves in a little bit. Close the curtain for privacy. And I'm gonna go ahead and verify the MAR with my physician's orders. So we're going to do cefazolin 1 gram IV over 8 hours for your pneumonia, and then that's also on your physician's orders. And I also want to check the physician's orders to make sure that this is supposed to be running this primary IV, which it is, so that's good. Alright, so I'm going to start by talking about your cefazolin sodium, or ANSEF. So the safe dose is 250 milligrams to 1.5 grams every 6 to 8 hours, and we're giving you 1 gram 8 hours, over 8 hours, so that is within the normal dose. Indications: treatment of serious infections, so like your pneumonia. Dilutions: 50 to 100 milliliters of normal saline, you dilute that with. Rate of administration: each 1 gram or over 3 to 5 minutes. Precautions: watch for early symptoms of an allergic reaction. Make sure the patient, so Joe, make sure you report any symptoms like difficulty breathing to me or feeling anything funny. Side effects: diarrhea, allergic reactions, pain at the site, nausea, vomiting, or oral thrush. Related diagnostics: so you want to check your liver because it can elevate your BUN and creatine. Antidote: so we just immediately tell the physician if you get any adverse effects and immediately stop the site, and if you were to get C. diff, we would treat that with fluids and electrolytes, protein supplements, and or antibiotics. And I want to then check your IV site, so make sure there's no phlebitis or inflammation of the vein, which would be warm and red warm to the touch and red and puffy, or infiltration, which would be any pooling of the IV solution because the IV catheter is no longer in the vein, so we'd feel around. There's no pooling. Any pain with that? No? Okay. Then I am going to do my first check with the medications against the MAR. So I have cefazolin 1 gram IV, so cefazolin 1 gram right here, and that's in 50 milliliters of the diluted solution. So I first check of that, and then I'm going to show you my IV rates. So this would be 50 milliliters over 20 minutes. We're gonna do, so it would be 150 milliliters an hour, convert that, or 25 drops a minute, which would be 6 drops per 15 seconds is what we're going to do. Then I'm gonna do my second medication check. So we have cefazolin 1 gram, cefazolin 1 gram. I'm gonna do my 5 patient writes. So write patient, write medication, write dose, write route, write time. I'm gonna do my third check of the medication. So cefazolin 1 gram, cefazolin 1 gram. And now I am going to check the packages. So make sure everything's intact. Check the expiration dates. So I'll go ahead and open this. There's no crystallization of anything, the medication, so that looks good. I'll wash my hands again and go ahead and put my gloves on. So check this package also, make sure it hasn't been opened. Maybe get it open. Oh my gosh. And I want to close this clamp right away. That's closed. I'm going to go ahead and lower my primary IV. Now we're going to spike the bag using aseptic technique. Going to hang this. I'm going to scrub this port closest to the bag for 30 seconds. Unscrew this cap. Okay. I'm going to lower this one and open it up. It's going to let all the air out. And it filled it about halfway full and then I stopped it, so there's no air in there now. Okay. So now I'm gonna go ahead and do my drip rate. So I can open this all the way back up. And I'm going to control it with this. I'm going to do 16 drops per 15 seconds. And what's your watch? Oh. So 6 drops per 15 seconds. Okay, so I have 6 drops for over 15 seconds. So now that's running and everything, and then I would label my medication bag in the tubing with the date, time, and my initials. I document and ask Joe if there's anything else I can do for him, and also now going to explain how to take out the IV when this is all done, so we're ready to take it out. So I would make sure I lay a cloth saver under the arm in case any bleeding happened. I'd wash my hands and put on non-sterile gloves. I'd take off all the bandage wrapping that's holding the IV down. I get a 2x2 gauze and place over top of it, but not holding any pressure. And then I'd pull the catheter out straight with the vein. And then I'd put pressure on that for 2 to 3 minutes. And then I'd lift it up and replace it with a bandage or another gauze and tape down. And that's it.